Dear viewers, welcome to a new episode of our program, and today I will be talking about food sensitivities. Sometimes we do feel lethargic, tired, not in a great mood, and this can be due to some vitamin deficiencies or maybe nutrient deficiencies like iron, for example, causing anemia. It can be even due to other serious health conditions, but we should not rule out food sensitivities because they do give us similar effects.
During an allergic reaction, the immune system responds to a normally harmless substance as if it were a threat. In some people, common foods such as milk, eggs, and peanuts can trigger such a reaction. So how does this work? If you have a food allergy, your immune system makes a type of antibody called immunoglobulin E, or IgE. This class of antibody binds to immune cells called mast cells and basophils that circulate throughout your body. When you are exposed to the food allergen, it attaches to the IgE antibodies. This binding signals the immune cells to release histamine and other chemicals that cause allergy symptoms, such as swelling of the lips, hives, and shortness of breath. Because mast cells and basophils rapidly release these chemicals, an allergic reaction typically occurs within 30 minutes after exposure. The most severe kind of reaction is called anaphylaxis, which can cause a sudden drop in blood pressure, trouble breathing, dizziness, and possibly death. People with food allergy and poorly controlled asthma are more susceptible to severe reactions. An anaphylactic episode must be treated with a hormone called epinephrine, which maintains blood pressure and opens up the airways. To deal with accidental exposure, people diagnosed with food allergy are prescribed a medical device called an autoinjector that delivers a single dose of epinephrine into the thigh muscle. Antihistamines alone are not an effective treatment for anaphylaxis. There is no cure for food allergy. The best way to manage the condition is to avoid the allergenic food, read food labels carefully, wash hands and household surfaces, and always carry an epinephrine autoinjector. If you are accidentally exposed to a food allergen, seek medical help immediately. The National Institute of Allergy and Infectious Diseases, or NIAID, conducts and supports research to better understand, prevent, and treat food allergy. In 2010, an expert panel sponsored by NIAID issued guidelines to assist healthcare professionals in diagnosing and managing the disease.
So, what are the telltales of these food sensitivities? If you suffer from frequent constipations, or exactly the opposite, loose motion, if you sometimes feel that you have bad breath or gas or nausea, heartburn symptoms, or even a stinging pain in your stomach, a burning pain in your stomach, this may be due to some food sensitivities. And why is that so? Because some types of food, if we're sensitive to, may throw off the gut microbia or the bacteria, the healthy bacteria in the gut, and the enzymes, causing series of problems in your guts, and that would lead also to these symptoms. So you may feel, for example, you have decreased acid in your stomach because of this food sensitivity. So this will lead to undigested food, it will lead to lower immunity, it will lead to gut cell damage. So you will find there is some permeability of food or liquid from the gut, all due to these foods that cause some sensitivity to you. These foods differ from one person to another, but there are commonalities among these foods. Some foods are known to be major causes of sensitivity to some people, and some are very specific to others. I would recommend that you watch yourself, monitor your intake of food, and I will guide you through techniques and methods of following a diet that may help you identify these foods and get over these little problems. Please stay tuned and you'll know more about it in our next segment. Dear viewers, welcome to the second segment of our program, and today we're talking about food sensitivities. As we've mentioned earlier, that our gut will help us tell about these foods that cause insensitivities, but the effects go beyond the gut as they may target other organs like the brain. For example, if you feel that you're lacking concentration, you have a brain fog, you have a swing in mood, and even hyperactivity or kinds of ADHD where there is lack of concentration or hyper distraction of doing things, that may also be a cause of some kinds of foods that may cause some sensitivities. Also, our joints may be affected. Arthritis may be due to some kind of food sensitivities. Asthmas as well may be triggered by some food insensitivities, so it goes really beyond our gut and it may target different organs, including our skin, for example, when we have the outbreaks that also may be attributed to some foods that we eat. So how do we overcome this thing? We can do that through an elimination diet. I told you earlier that there are foods known to cause sorts of food insensitivities, and I'll start by fruits. Almost all fruits are fine, but usually citrus fruits are considered triggers for food insensitivity for some people. Others may suffer from exotic fruits like pineapple or mangoes or papayas. But if you don't really feel any of the gut symptoms we talked about earlier, that means you're safe and you can eat any fruit. Vegetables, most vegetables are also safe to eat, whether sautéed, raw, in salad format, roasted. However, there are 3 types of vegetables that are known to cause some food sensitivities to people. The common ones are tomatoes, eggplants, and white potatoes. So if you have them and you feel any of the signs we talked about earlier, that means you should consider elimination diet to really identify which one of these is affecting you. As far as starches are concerned, usually rice is very safe, but wheat and gluten containing kinds of grains may trigger some food sensitivity to some people. Legumes usually are fine, but again, sometimes some people are allergic to peas or lentils. Seeds and nuts, you're either allergic to most of them or you're not allergic at all to them. Meat, probably turkey and fish are fine, but most shellfish may cause sensitivity to many people. Please stay tuned. I'll talk about more of these foods and how to identify their sensitivity. Dear viewers, welcome back to our program, and we're talking about food sensitivities. Of course, a lot of people are allergic to milk or sensitive to milk, let's put it in that way, either to cow's protein or to lactose itself or to any other component of milk. Usually coconut milk is safe, and people can have almond milk or coconut milk instead if they know it's causing a lot of gases or bloating or any kind of the gut symptoms that may really draw your attention to a possibility of food sensitivity. As far as fats are concerned, usually the cold expeller processed fats like olive oil, for example, are safe and they do not cause allergies, but usually margarines may cause a kind of sensitivity. Hydrogenated fatty acids, which are used in processed foods, may also cause some kind of sensitivity. Beverages, water will not cause sensitivity, herbal teas will not cause sensitivity, sodas and caffeine may for some people. So again, I need to draw your attention that the frequency of exposure to these foods may enhance the sensitivity. So if you're having any of these things occasionally, not on daily basis or more frequent, then that means you may not be sensitive to it, or the intensity of sensitivity will not be there. To follow an elimination diet, usually it works if you follow it for at least 3 weeks of eliminating anything you suspect, and the 4th week you start adding 2 or 3 items. For example, you can add starches, eggs and milk on week number 4 and be vigilant to see if there is any effect. The 5th week you can add legumes and nuts, for example. The 6th week you'll go to fruits and vegetables that you were suspecting, like the eggplant or tomatoes and citrus fruits. And one of the very good tips, if you want to follow an elimination diet, you have to be ready for it. First of all, clean your kitchen from any foods you suspect. You don't want them lying there in your refrigerator or in your closet and then not be able to resist the temptation when you have it. The same applies to your shopping list. Prepare a shopping list, making sure you won't purchase things that you suspect or fall into the do not eat foods list, so you would know that they're not out there. And keep a food journal, so if you find any of the symptoms or discomfort associated with the consumption of these foods on week 4, 5 and 6, so you would be able to know that yes, specifically this food is the one that caused allergy or sensitivity in this case. And if you find that the sensitivity is not there, but it may reoccur later, that means only cut back on the frequency of intake and it's not that harmful for you. Eat healthy, watch us, and hope to see you in another episode. Thank you.